Most people will experience some indigestion or heartburn at some stage through their life. When you think about it, most people, at least in the developed world, are eating 3 meals a day. And heartburn or indigestion is something that is likely to come on after meals. Therefore, proper guidelines for its management should be understood to diagnose and treat the patient. Firstly, you should know that heartburn means burning chest pain, sometimes gnawing. Secondly, you should be aware of all such aggravating factors which makes heartburn worse: anxiety, alcohol, aspirin, certain foods or medications. Now there are some important questions that you need to ask your patient before making a diagnosis. You will ask the patient what symptoms they are experiencing, including anxiety, depression, weight loss, weakness, abdominal pain, nausea, vomiting blood, tarry stools, results of any recent tests of the insides of their stomach, any successes with previous treatments or diets. You will ask your patient if they or anyone in their family have had any of these conditions: abdominal surgery, liver disease, arthritis, chronic lung disease, alcoholism, ulcer disease. Then you will ask the patient when and how they first noticed their heartburn, and how many times it has recurred. Next, you will ask the patient if they are taking any medications, including aspirin, steroids like prednisone, warfarin, or Coumadin, other non-steroidal anti-inflammatory agents like ibuprofen, Motrin, indomethacin or indocin, alcohol, antacids, and acid-reducing agents like cimetidine, ranitidine, and omeprazole, or anticholinergics such as Benadryl, sedatives, tranquilizers, antibiotics, coating agents like sucralfate. Now, after knowing the history of the patient, you have to examine the patient. Well, this physical examination includes blood pressure, pulse, pushing on the abdomen, and checking stool for the presence of blood. Heartburn can be a cause of ulcers. Now, some important factors to consider with ulcers caused by heartburn. Ulcers are caused by the movement of stomach acid up into and through the esophagus, which connects the throat to the stomach. Over time, this movement of acid can lead to ulcer or irritation of the stomach or intestinal lining. Ulcers frequently recur, and to keep this from happening, you should advise your patient to limit their intake of caffeine, cigarettes, alcohol, and certain medications. Stick to their treatment plan once they experience any symptoms. Report any signs that they may be experiencing, such as gastrointestinal bleeding, such as overly dark stools, vomiting blood, or weakness when standing. If, after avoiding the factors listed under what can make it worse, the patient still have pain, you should perform some additional diagnostic tests to understand the patient's problem. Some ulcers can even be caused by bacteria, so you may give the patients antibiotics to cure their ulcers. So now, if you are clear about your findings, you can manage your patient accordingly or do further investigations if required. That was all about the differential diagnosis of heartburn. Stay tuned to sqadia.com for more such precise and knowledge-stuffed videos.